Hi, everyone. My name is Carrie Ananaya. I am a board certified PA, and I am the Assistant Director of Clinical Education here at Biocidin. Today, we are talking about hormones and the microbiome, specifically the estrogen and how it influences estrogen metabolism. So as I said, I am a PA and I work for Biocidin. I currently own a practice as well and practice functional medicine. And I fell in love with Biocidin clinically, which led me to this position. And I'm just honored to get to present on behalf of Biocidin today. So we'll go back to the basics here, start with the basics. How does estrogen metabolism work? Estrogen occurs physiologically in numeric order. So phase 1, then phase 2, then phase 3. But clinically, we should really address it reversely, phase 3, phase 2, phase 1. Initially in phase 1, this takes place in the liver. There are 3 metabolic pathways that estrogen can travel down, and you can see those in this Dutch test sample report on the right. The CYP1A1 pathway, the CYP1B1, and then the CYP3A4 pathways. This results in the form of 3 hydroxylated estrogens. We have the 2-hydroxy-E1, the 4-hydroxy-E1, and the 16-hydroxy-E1. Secondly, we have phase 2. This is conjugation. This takes place in the liver. The estrogens become deactivated so they can be eliminated, requiring certain nutrients and enzymes to be used in the body. Specifically, this requires sulfation, glucuronidase, and methylation, and it heavily relies on 2 enzymes, the COMT enzyme and the MTHFR enzyme. Then we have phase 3. This is elimination. This takes place in the gut. The deactivated estrogens from phase 2 are packaged up and then eliminated from the body through the stool. Bile is necessary to help this elimination. And then conversely, if there's inflammation, dysbiosis, or just overall intestinal health function, this can all impact how smoothly this phase goes. So what is the estrogen? The estrogen is part of the gut microbiome. And so I thought we'd talk about the gut microbiome initially at a glance. Our gut microbiome is composed of an average of 39 trillion microbes. I always tell my patients there's more microbes there than there are stars in the Milky Way, which just like blows my mind. It's a diverse group of bacteria, fungi, protozoa, archaea, and different viruses, and is dominated by 3 different phyla. So we have the gram-positive firmicutes, the gram-negative Bacteroides, and the gram-positive actinobacteria. Our gut microbiome plays a role in the functioning of our metabolism, our immune system, and neuroendocrine functions. Now, specifically, the estrogen is a collection of enteric bacterial genes whose products are capable of influencing estrogen metabolism. So this metabolizes and modulates the body's circulating estrogen, and this then in turn affects weight, mood, libido, and an accumulation of lifetime exposure to estrogens, which we know is a concern when we're looking at cancers that are specific to estrogens. It also has an effect on other sex hormones. So testosterone itself causes a greater microbial shift in the microbiome compared to a prepubescent microbiome. This increase in that microbial diversity then increases short-chain fatty acid production, which then in turn increases sex hormone levels. A lower microbial diversity, on the other hand, would result in lower sex hormone levels. So what are some things that can cause this disrupted microbiome? Many different things, but a few are antibiotic use, chronic stress, steroid use, a low-fiber diet or the SAD diet, the standard American diet, lack of exercise, travel, mold and toxic exposures, poor sleep, and food sensitivities. The results of this disrupted microbiome are far-reaching as well. So we can have bacterial overgrowth, we can have parasites, an insufficiency dysbiosis of the good microbes, impaired digestion, leaky inflamed tight junctions, elevated beta-glucuronidase levels, and then of course, hormonal imbalance. So how does this gut dysbiosis influence hormones? Intestinal permeability first leads to inflammation, and then this inflammation suppresses ovarian hormone production. As you can see here, in a healthy microbiome, the ovaries signal to the body, which use the liver, which signal to the gut. And then most of our estrogen exits the body, some goes back in. And what you can see is that if we have an elevated beta glucuronidase, it contributes to estrogen excess. And so what we see in this diagram, and I apologize, my text is covered up, but the diagram explains it really well. In an unhealthy microbiome, we have the ovaries, the body, and then the estrogen to the liver and then to the gut, but this beta glucuronidase inhibits that estrogen elimination. So most of the estrogen goes back into the body, creating an estrogen dominance-like picture. And I think I'll talk more about phase 1, 2, and 3 real quickly here, because this goes really close in hand with beta glucuronidase. I'd like to imagine estrogen detoxification as a bathtub. And I credit Dr. Carrie Jones for a similar visual that inspired this for me. But imagine those 3 phases. So we've got phase 1, phase 2, phase 3 of estrogen detoxification. Phase 1 has those 3 pathways that estrogen can go down. Imagine those 3 pathways as 3 different water faucets on your bathtub. There's a cold water, a hot water, and a perfect temperature of water. Phase 2 is that methylation phase. And so imagine that as the size of your tub. If you have poor methylation activity, your bathtub would be small. If you have too much methylation activity, then your bathtub would be too large. That third phase, which we're talking about here with beta glucuronidase, is the drain. It's the drain leaving the tub. So you can imagine, like I said, even though estrogen metabolizes 1, 2, 3, if you have a plugged bathtub drain, but your tub is the perfect size and your water temperature is perfect, it doesn't matter, right? All of that water is still going to overflow because you have that plugged drain. So looking at beta glucuronidase and looking at the microbiome is how we are addressing that plugged drain, or that third phase of estrogen detoxification. Okay, so what is this fancy word, beta glucuronidase? What's it all about? In phase 3, what happens is the liver and the intestine bind toxins and different steroid hormones. So maybe it's environmental toxins, or other eliminated toxins from the body, medications, alcohol, and then steroid hormones similarly also bind to be eliminated. So the estrogen gets to the liver binds this hormone with glucuronic acid, just like it binds other toxins. And this protects the body by limiting absorption and reabsorption of those toxins and hormones back into circulation, enhancing their excretion in the stool. So that binding of glucuronic acid is the signal to the body to eliminate those toxins and hormones after they've been broken down and used. However, beta glucuronidase comes in the picture and is like, nope, not today. And it breaks that bond between glucuronic acid and toxins or hormones in the intestines, and then sends those things back into circulation. Beta glucuronidase is produced by intestinal epithelium, but then also certain bacteria. So you can see how this creates a really complex picture where your body is trying to eliminate things and detoxify things, but we've got this beta glucuronidase in the picture creating kind of a mess. High levels of beta glucuronidase are not desirable, as you can imagine. Higher levels have been associated with higher circulating estrogens and lower fecal excretion in women. Lower levels clinically are not much of significance currently that we've seen, but high levels are commonly associated with an imbalanced intestinal microbiome. And you can see here, this is a sample report of one of my patients. And everything I say here, this is a good time for a disclaimer going forward. Everything I say here about this case is my own personal clinical experience and has not been reviewed and should not be taken as a suggestion, but more so just a learning experience from my own clinical practice. This was a patient, actually, she was very young when she was diagnosed with breast cancer. She was 38, never had children, never really had hormonal dysfunction that she said early on. Upon questioning later when she saw me, we revealed some things, but her GI map stool study revealed a beta glucuronidase of almost 6,000. I would say ideal for my patients is 800 to 1,000. So you can see that it was significantly elevated. What we then see in cancers is that elevation contributes to excess estrogens in circulation, creating estrogen dominance and a higher risk of a breast cancer. So some major producers of beta-glucuronidase are bifidobacterium, lactobacillus, escherichia, clostridium, bacteroides, ruminococcus, staph, and eubacterium. Some symptoms associated with high levels of beta-glucuronidase are very similar to those of estrogen dominance: heavy periods, clotting, cramping, fibrocystic breasts, headaches, mood swings, weight gain, fatigue, anxiety, irregular periods, infertility, and brain fog, to name a few. This is the same patient's GI map results continued. You can see on the first page, she did have some salmonella, and my question was, why didn't her stomach acid take care of it? She doesn't have H. pylori, as you can see, but she did report symptoms of low stomach acid, and when we did the burp test, she failed pretty significantly and really did struggle with symptoms of low stomach acid. Look at her normal flora. It's completely wiped out. So she's got a very significant insufficiency dysbiosis going on here. If you look at her phyla as a whole, her Bacteroides and Firmicutes are completely wiped out of normal range. And that alone represents 95% of the microbiome. And so as a whole, like I mentioned, she was just very depleted. Interestingly, she didn't have a lot of opportunistic bacteria. That was a good find. It's something I appreciated finding. Oftentimes when I see an insufficiency dysbiosis, we see a big mess of opportunistic bacteria due to the lack of protection from the good flora. In her case, thankfully, that wasn't what was going on. We did have some overgrowth of some staph and some strep and bacillus that we needed to take care of, and then some rhodotorula, but not a lot going on there. Now, a lot of this could be hiding in biofilms too that weren't revealed until we started treating. And then I should go back real quick and just mention that beta-glucuronidase level that was so significant for her. In fact, when she followed up with her oncologist, it was funny because they always said, wow, even though you are on tamoxifen, your hormones look great. You are definitely not in menopause yet. She's like, that just seems so odd to me. She works in the veterinary world and has some science exposure. And she said, that just seems really odd to me that here we're supposed to be suppressing my estrogens, but yet it doesn't show any signs that I'm in menopause. Lo and behold, she was working with me. I explained, well, this beta-glucuronidase being so elevated is likely contributing to an excess of estrogen in circulation, making it appear like you have adequate levels. We treated her gut. She went back on follow-up, and sure enough, hormones tanked. So she was definitely in menopause. It was a falsely elevated serum result because of the elevated beta-glucuronidase that she had. So what did we do? What are some therapeutic treatment options? We have to, of course, rebalance the microbiome. This is first and foremost. Patients get a 58% improvement in their hormones when we balance the microbiome. And you can see it's because of all of this interplay between the gut-liver axis and hormonal balance, and even, the gut-brain axis as well. So my favorite things to use are Biocidin, the liquid and the capsules on certain occasions. The liquid is definitely my favorite. It coats the entire GI tract. It supports gut health. It can help reduce bloating and gas, improves regularity, it supports just whole body comfort. It's broad spectrum. So in this case, we could use it and confidently know that it was going to work against the different microbes that she had on her GI map. And it dismantles biofilms, which we all know in this field is such an important part of our patient's treatment plan. And then it can actually enhance her, in my patients, the low beneficial microbes, it actually enhances those levels, which is really nice too. A lot of times beforehand, when I first started practicing, I was using Designs for Health supplements pretty exclusively for my GI map patients. And I just was not getting the success I was having with Biocidin in my pediatric patients. And I really started to dig into this and look and see why. And it's definitely this biofilm dismantling property of Biocidin that makes it so beneficial, but it's also the broad spectrum activity as well. And it's tolerable. My patients tolerate it so much better than they ever did before. So specifically, some hormone benefits of using Biocidin is it has that broad spectrum activity, like I mentioned, that lowers opportunistic bacteria. This lowers beta-glucuronidase activity by lowering the bacteria that produce it. And then it also can help improve vitality and mental clarity. Feelings of emotional distress and brain fog are often seen with estrogen dominance. And so this can help mitigate those things. Olive iris is another one that I add in oftentimes with my patients, especially more complex cases. It's a high potency olive leaf combination. It also offers broad spectrum support, and it works really well for like seasonal wellness if you pair it with our throat spray, but supports that whole body wellness. It helps maintain healthy energy levels, and the oleoprene in it is superior that offers that broad spectrum support. I really like it for my viral patients as well. So if you're concerned about chronic viral loads, I use it in those patients. And then I really love that it supports the drainage pathways through the liver and the kidneys to help assist in that detoxification. Not only are we using our stool to eliminate these estrogens, but we also need to use a little more help from the liver and the kidneys to detoxify these hormones. And so this is where olive iris is a really great thing to pair with the Biocidin. There's also more enhanced support, as I mentioned, for those complex cases. So those that have significant overgrowth or several different varieties of opportunistic organisms, because those are the ones that then produce more beta-glucuronidase, elevating estrogen levels. Then there's our Proflora. This is a probiotic combination support formula. It supports healthy immunity. It supports microbial balance in the GI tract. It assists in maintaining intestinal health to make sure that you're absorbing nutrients appropriately, helps with that healthy gut barrier, and plays a major role or a primary role in the development of the gut-associated lymphoid tissue, or the GALT system. Specifically from a hormone standpoint, it helps with that inflammatory response. If you remember, excess inflammation leads to a sluggish phase 3 detoxification of that estrogen. So by using the Proflora, we can help mitigate that. It also helps promote the good bacteria, keeping beta-glucuronidase producing bacteria in check. Biotonic is one of my newer favorite things. I always liked it, but I've fallen more in love with it lately. It helps maintain healthy energy levels. It supports healthy digestion, supports vitality, and it provides additional nutrition support for the GI tract, liver, and adrenals. And the reason I love it so much more lately is it's that supporting vitality. When you start to work with patients, or at least what I see in practice is women come in and they tell me, I need my hormones fixed. And I'm like, you're right. After, an intake, I agree that you probably do need your hormones fixed, but let's talk about your gut first. And they don't quite get that. There's definitely an education piece that has to happen there. And so I educate them on the association with the microbiome and hormone balancing. And then I tell them, we can use this Biotonic to not only help support breakdown of nutrients and, digestive support to help with those, the detoxification pathways and metabolic pathways to break down estrogen, but we can also use this as an adaptogenic tonic to help support mood and energy. And they really like that they're kind of killing two birds with one stone, for lack of better words, but it does work when you need to kind of work on some of the hormone symptoms, but you really want to focus on the gut as well. And again, those detoxification pathways, as I mentioned, are so important that they are working efficiently. Then there's our GI Detox. This is a binder. It's full spectrum and it's very gentle, which is what I appreciate about it. It supports healthy detoxification and full body cleansing. It assists in the mop-up of endotoxins and those biofilm components. When those are released, a lot of various things can kind of come out. We don't always know what's in them, but it can definitely create an unpleasant experience for your patient. So by giving them the GI Detox, it mitigates that herxing that you might see. Also supports mycotoxin clearance, gives the patients a more comfortable cleansing experience, can help reduce bloating and gas, supports mental clarity, and is really great when to keep on hand, like if you're traveling or if you get a stomach bug. We've put this to good use at our house. We have 2 little kids at home and it never fails. Once a year, we bring home a stomach bug, but the GI Detox allows us to, we dose up on it as quickly as we can and helps to bind that and eliminate it so we're not suffering as long. Specifically for hormone benefits, it provides enhanced binding support to eliminate those buildup toxins and estrogens. If you can imagine, my patient due to all that beta-glucuronidase, there was a lot of built up toxins and estrogens that had not been eliminated. And so as we started to treat things, she really needed that enhanced support to bind it or mop it up to eliminate it out, which then helped mitigate those die-off reactions that she could have experienced, you know, like gas, bloating, headaches, brain fog, etc. We don't often think about oral health in its conjunction with systemic health, or at least as much as we probably should. One of the things I love to do with my patients is to make sure that their oral health is being treated as well as their gut health. The reason being, we have studies that show that patients who brushed their teeth after every meal versus once a day had significantly less levels of candida on stool study testing. And it just goes to show you how much every time you swallow saliva, how much that's re-inoculating your GI tract. And if we're not addressing oral health, we can really disrupt the systemic gut health that we're trying to achieve. So I love, love, love our toothpaste. I wake up with my teeth feeling clean still. You know, oftentimes you wake up in the morning and you're like, oh, I cannot wait to brush my teeth. With Biocidin, I wake up with still fresh, clean feeling teeth. It creates a gentle and effective cleaning and whitening. It helps maintain that oral health, like I mentioned. It assists in removing biofilms and plaques and supports oral microbiome balancing, and also is broad spectrum, just like our Biocidin, and then helps or contains specific botanicals with antioxidants to soothe tissue. Specifically, like I mentioned, this helps avoid reinoculation of the gut with opportunistic bacteria from the mouth, and it helps support cleansing of the entire microbiome to hopefully then lead to hormonal balance. Of course, we can't do all of these things without discussing the lifestyle changes that really should take place with patients as well to also help support a healthy microbiome and overall hormonal balance. So some different things I do to help support the microbiome: I increase fiber intake. Fibers support that healthy microbial balance. This patient was really deficient in a lot of her good fibers, so we had to increase diversity of fruits and vegetables in her diet to make sure she was getting those. Again, eating the rainbow of phytonutrients. We mentioned this a bit, but every color provides various microbiome supportive fibers. So I tell my patients to aim for 5 or 6 colors on their plate. And making sure that they're exercising and sweating daily. Stress management is improved, detoxification pathways are upregulated. That's one of our detox pathways, is sweating. And so making sure that that's being optimized as well. And of course, sleep must be a priority. A disrupted circadian rhythm really disrupts the microbiome and hormones as well. So really getting patients back on a good sleep-wake cycle and a good sleep routine at bedtime is important. Adding extra immune support like vitamin D and zinc and vitamin C and quercetin. A healthy immune response helps to keep the inflammation down, which then in turn supports hormone production. And then using meditation or other stress modifying techniques just to help battle that constant fight or flight. Being in a state of constant fight or flight is a really easy and quick way to disrupt hormonal balance and wipe out the microbiome. Chronic stress just takes a big toll, not only hormonally on us, but also on our microbiome, and wipes out those good microbes.